Well, it's always nice to get to the point. So let's get there. We don't have a treatment, nor do we have a vaccine. The only way we can treat this for now is to prevent it. And to prevent it, we need to understand the nature of this disease. So I am going to give you all of that in this video. So namaskar ladies and gentlemen, this is Dr. Rahul Singh aka Drsinghtastic, and I once again welcome you to my channel. So in this video we will see exactly how to deal with somebody who is at home, who is showing some signs and symptoms that may be pointing towards COVID-19 infection. I will tell you exactly what signs and symptoms you should be looking for and what kind of tests that you should be doing by yourself, and also when to approach the COVID-19 center for further examination. So the infection happens when a droplet from an infected person comes in contact with our eyes, nose and mucous membranes, and it will take 3 to 14 days before showing the first symptoms. So what should you do if you have someone sick at home and showing those symptoms? You need to look for these 5 or 6 things that this person might be having. First thing, you should check for temperature, then check if the person is having cough, dry cough or sneezing, then chest tightness, breathlessness and fatigue. So if the person is having at least three like temperature, cough and fatigue and not having chest tightness, then I can tell you as a doctor there are 100 other conditions in which a person might have those. So we can say that it is not COVID-19, but we cannot completely eliminate the fact that even COVID-19 in the initial phases will show up symptoms and signs like these. So isolation is absolutely important at this stage. So there is an advanced screening method. If you want to go the extra mile and you want to do a blood test, then so you should do it. So the blood test that you should be doing is complete blood picture, in which it will show you the WBC counts and lymphocyte counts. So at this stage, we are all very concerned about ourselves and our loved ones. So we would want to go the extra mile and do that extra test to find out if this is really COVID or not. So all you have to do is get a blood test done. So get a CBC or a CBP test done, that is the complete blood picture test done, which will show you the WBC counts and also the lymphocyte counts. The Wuhan data is showing that the lymphocyte counts go down from a 20 to 40%, which is a normal, it goes down to almost 10%. Then of course you have a positive travel history, then also that points towards the COVID-19 infection. It's a likely case. So next very important question, do we take care of this person at home or do we take care of this person, should we take him to the hospital? You take care of them at home. The person should be put in a single room, a well ventilated room, no one else should be sharing that, with minimal access and of course a attached bathroom. Then you should have preferably white sheets in the room and white pillow covers and towels. That's because you can bleach them and you can wash them at higher temperatures without losing the color. So wash them at 60 to 90 degrees with a little bleach in it every second day. That should effectively kill all the viral particles in it. Then of course a general recommendation, patient should wear a surgical mask that prevents the spread, and the caregiver should wear an N95 respirator mask that prevents him from getting the infection. Then caregiver must wear a non-sterile glove. It may not be a sterile glove because anyway he's going to handle all the infected material. Then of course it goes without saying that you wash your hands and use a paper towel instead of a cloth. The disinfecting household items, this is a very important part because you have to maintain the isolation part of the house. Now I'll tell you in a later video how to make a very cheap effective disinfectant at home with less than 50 rupees a week. It's just using bleaching powder and water. According to the CDC, this is a very effective method in destroying the coronavirus particles. Now 60 to 80% ethanol that's in your hand sanitizers, of course it's always been there. Then of course 1 in 100 weight by weight bleach and water. Then you have soap and water. Yes, soap and water is also known to kill coronavirus particles. Yes. Then now if you're a caregiver, your job in those 14 days would be to check the body temperature of the person and monitor for cough, signs of dizziness and breathlessness. This is really important because just putting that person in for 14 days is not enough. So you should also have the emergency numbers on hand and also follow all necessary precautions at any cost. Now, fortunately for us, the Indian Council of Medical Research has given us some guidelines on when to actually go and approach a COVID-19 facility. So if the fever is going more than 100 and with the need of other tablets to bring it down, worsening cough, breathlessness, fatigue, body aches, and you have dizziness in this patient, then you should find the nearest COVID-19 facility. Reaching there, a physician will take a complete picture of this patient with the history and also the underlying diseases, and then order for a ELISA test. This ELISA test is a screening test for which a blood sample will be drawn from the patient and the serum will be extracted from it. The serum, once extracted, will be fed into the ELISA kit. The ELISA kit will give you a result within a few hours. Should you test negative, all good. You will be sent back to the home isolation place wherever you were living. You were asked to stay there for next 14 days just to be very sure that it's not COVID-19. Then you have another scenario in which obviously the person unfortunately tests positive. Now, should you test positive, do not panic. All you have to do is give them the information that who else is there at home, because they would want to know and want to do a test if necessary. Otherwise, they will just say, okay, fine, go back and tell you, they just tell your people at home to go into isolation for the next 14 days. So that will make sure, if they are infected or not, they will know. Now, the patient itself, as for the patient itself, will go to the COVID-19 isolation facility. The ELISA kits, the patient is now being admitted. So all the documentation will be done, history will be taken, what are the underlying problems, if any, high risk consent will be taken from you, because this is a very risky case, so you'll have to sign that's mandatory. And then a general examination will be done and assessment will be done, so as to find out at what stage your patient is at, or you are at if you are infected. So then you will be sent to an appropriate ward. A real-time PCR test will be done, which will confirm the presence of COVID-19 in your body. To really understand what this disease is about, you need to take a look at the high-resolution CT scans. So more or less, their lung picture is normal. Then you go on to the early phase where the symptoms begin. The fine arteries in the lungs, they begin to dilate, and gas exchange becomes a little problematic. It just begins to become problematic. At this stage, you just want to give them some oxygen through a mask. So this is a picture of the blood vessels, where the blood vessels, you can see the inner lining of these arteries will become leaky. It starts to become leaky, and because they are tortuous and they are widened now, they will begin to ooze out. So at about 3 to 7 days into the disease, that is the rapid progression phase, water starts to leak into the air spaces. The air spaces have to be dry for us to breathe and get the oxygen that we are breathing inside. It has to get dissolved in the blood. So, if the water comes in there, it becomes a physical barrier. So it prevents the transfer of oxygen into blood, and also it is important for the lungs to be able to throw out the carbon dioxide. So in this scenario, you will have the carbon dioxide being trapped in your blood, whereas the oxygen being trapped in your lung itself. So patients become progressively breathless, unconscious, unresponsive, and may also end up with a cardiac arrest. Who knows? And then you move on to consolidation. This consolidation phase is when the leaked water into the lungs, it is proteinaceous in nature. So the proteins will coagulate, they become lumpy and draw the walls of the lungs together. It consolidates and collapses. So this is like a situation in which is similar to pneumonia. So full-blown pneumonia kind of a situation you will have at the end of 2 weeks. It is quite disastrous, and in this stage, you may want to intubate your patients or start an NIV mask. That is the mask that I will show you a little later in the video. Now, the final and the last stage, you would want to put in an endotracheal tube, like I'm showing you in the video. The tube goes all the way to your throat and then forms a seal which is connected to a ventilator. So coming to the core of this video, that is COVID-19 treatment, which can be both divided into life support systems and also pharmacotherapy. Now let's just take one thing at a time, although both of them are started together. Now, coming to the pharmacotherapy, which tells you what kind of medicines are to be given in COVID 19, there are no specific guidelines as of now. So, the most famous or the most widely used one is the lopinavir and ritonavir combination of 250, and then you have the Tamiflu, which is oseltamivir, 150 milligrams twice daily. So that's also an effective drug that that the Indians have been using for a long time. Now, hydroxychloroquine, which is a medicine that has been widely used around the world for treating malaria, which was also endorsed by the President of the United States. And alpha interferon has been used widely in China through the nebulization route. It is known to reduce the viral load in the lung itself, so it's quite a fascinating drug. And then you have a piperacillin and tazobactam combination, which is widely used in ICUs around the world. It is to prevent secondary infections that the person is likely to have while being admitted in the hospital. Then there are other antibiotics to be considered. Then there is also another leg of treatment, that is corticosteroids, that are given to reduce the flow of water into the lungs. There's the one widely used is solumedrol, that is methylprednisolone, 40 milligrams once daily intramuscular. Diet is absolutely important again. 18 grams of protein 3 times a day in divided doses is recommended. Now moving on to the intensive care treatment. Life support systems are centered towards maintaining adequate oxygen levels in the blood. So the initial line of therapy starts with the administration of oxygen through this mask called as the face mask. This has a tubing that goes through a wall mount. The wall mount is connected to the oxygen supply in the hospital. Now the recommendations are that you start with 5 liters. You can control that with a knob. 5 liters of oxygen should be given initially through this mask to maintain a saturation. The saturation will be shown on this monitor here. Right now it's not connected. I can show you that there is a probe. This probe is there. You can see the infrared sensor inside, which goes onto your nail. It sits on your finger, which shows you how much percentage of oxygen is there in your blood. So the percentage has to be about 90%, and in pregnancy even more, up to 95. That's the current recommendation. So in the second phase of the disease, the patient begins to have symptoms of breathlessness. There's fluid leakage into the lungs, and thereby the patient is not able to breathe. Patients will also have difficulty breathing with the regular mask that I just showed you. This is because the patient has to put in all the effort to breathe in. But now, since the water is leaking, you need some external force in the air that is going into the lungs to fight that fluid coming into the air spaces of the lungs. So this is a device called as a BiPAP. This is a BiPAP mask that fits in perfectly on the face without any gaps. The BiPAP machine sends in pressurized air just enough for the person to breathe without overinflating the lungs. There could be a dramatic improvement in the percentage of oxygen. So let's say we are facing a patient who has not responded to the initial therapy of oxygen with this regular face mask. Then we moved on to put this patient on a NIV, that is a BiPAP mask. So say if this patient did not respond even to this, then we are left with no option but to go ahead and intubate the patient. So this is a device, it is called as a laryngoscope. We put it in the throat, we look for the vocal cords and pass in an endotracheal tube. So this tube goes all the way into your windpipe. Then there is a little cuff that gets inflated and forms a pressurized airtight seal inside. So this, the other end of it, is connected to a tube that goes through to a ventilator. And if everything fails, there is extracorporeal membrane oxygenator. Not every facility will have that. Now, what other tests would we do? That is like a whole bunch of tests, because it's not just one system, it's not just the lungs suffering, it's all the other organs like the liver, the heart and the brain. All of those have to be tested adequately. Now, to just put everything in perspective, the first one is the asymptomatic, mild and moderate, moderate and severe, and then the critical disease. The first one will have no symptoms. The second will have cough and cold, can be treated with just a mask. Then you have the third one, which is moderate and severe. You need a BiPAP mask maybe, and the critical will need intubation. Finally, if the patient is getting better, you test for clearance. But then the real question is, does the immunity hold? Does immunity develop to a novel coronavirus infection? Immunity is like an instruction manual to our body on how to kill a virus. So it has two ways to learn that. One is to learn it the hard way, to get an infection and develop a natural immunity to it later on by exposure of the virus itself to the defense system. Second is to get it from a third party, that is a vaccine. So long-term immunity, this is the real question that scientists right now are working on. The new routine should be social distancing, isolating persons who are sick and then maintaining that distance from people, because it's going to take quite a lot of time to develop a vaccine, because developing a vaccine is not easy. It takes a lot of research, a lot of members who participate in it, and to check the real safety standards of a vaccine are really important. As of now, the only effective method to stopping this pandemic from getting any worse is by containing it, both at national and international levels. With that said, I would like to conclude this edition with a humble request to you to adhere to the lockdown guidelines. Thank you very much, and remember, stay home, stay safe.